So we're moving to the next stress test that we'll be talking about this evening. Now this is a Varus stress test. Varus stress test. Now there's another one like Varus stress test though, but we're talking about the Varus one, or probably we might have discussed them together, okay, for you guys to actually understand it better. Okay, but let's just discuss, since we seem to have only this one here. So Varus stress test, so that's a clinical examination. You are using this to actually assess the integrity of the lateral collateral ligament. Do you understand? So lateral collateral ligament is that ligament of the knee that is on this outside. Do you understand? The one inside is a medial collateral ligament. Do you understand? So for the knee Varus stress test, that's the full how they actually always call it. You are doing this to evaluate lateral collateral ligaments and any other lateral structures of the knee. Do you understand? So you are doing it to assess for things like sprains, tears, or any instability. So how is it performed? Position: the patient is lying down. So the patient is lying down on their back while you are standing, okay, at the end of the bedside. So technique: the examiner holds the ankle and applies an inward force to the knee while stabilizing the thigh. The test is done in two positions: full extensions and also 30% flex. You understand? So interpretation: if it is positive, there is excessive gapping or pain on the lateral side. Of course, the patient will shout and all of that, you know. So it shows that there's issues like what? Grade 1 is mild sprain, you know. Grade 2 is partial tears, you know. Then grade 3 is complete rupture. So you pick it up depending on how the patients react. You understand? So we also have the elbow Varus stress test. Okay, so there are actually two types. So this one is to access the radial collateral ligament of the elbow. Technique: elbow is slightly flexed. Okay, you can see that this one, they are kind of like bringing it down. That's a flexion on the leg. The leg flexion is backwards, while flexion of the elbow is what's upward. Now this is because the upper limb rotates earlier on in development, you know. So the examiner applies a medial directed force to the distal forearm while stabilizing the upper arm. Interpretation: pain or excess movement of the lateral side suggests that there have been an injury to the radial collateral ligament. Okay, so that's it for the Varus stress test, divided into the type for the knee and also the type for the elbow.